else here?
Her head involved.
Oh,
The release of TRH stimulates the release of prolactin. So if I don't have these,
You might not have TRH.
no, I do have TRH. If I don't have these, my negative feedback mechanism is gonna say, because my thyroid is not working, right? I have my thyroid gland here, and it's not working. So I have a primary hyperthyroidism because it's my thyroid gland, it's not working. So if my thyroid gland is not working, the hypothalamus is gonna constantly secrete TRH, right? Which is gonna stimulate TSH. But because it's constantly secreting TRH, which actually stimulates the release of prolactin, you're gonna have an excess prolactin because you're constantly secreting TRH. Because TRH and TSH is high in a patient who has primary hypothyroidism. Because that negative feedback mechanism says, well, I don't have T3 and I don't have T4, so I need to stimulate the release. And if I need to stimulate the release, I'm gonna constantly secrete TRH so that I can stimulate the pituitary gland to release TSH. That's why when you have a patient with hypothyroidism, your TSH is always very high.
Because they keep
Yeah,
on.
but in that case, what we don't have is prolactin, right? So it might not, we might not have enough TRH, right?
What? Why would a physician need to check the thyroid studies in a patient with hyperprolactinemia? Too much prolactin, okay? This person has too much prolactin, and they have too much prolactin because TRH is a factor that actually stimulates the release of prolactin. So if I have too much TRH, it's gonna constantly stimulate the release of prolactin because it's gonna stimulate the anterior pituitary to release prolactin.
so
Yeah,
does
tires
that,
are not working.
Because TRH is a prolactin releasing factor. There are several types of prolactin releasing factor. Prolactin release is in several ways. Dopamine actually is a blockage. And I think I actually said this in the beginning. Dopamine blocks prolactin release. There are different prolactin releasing factors. TRH is a prolactin releasing factor. Serotonin is a prolactin releasing factor. So if I have a drug that increases my dopamine, then I'm gonna have low prolactin because I'm gonna constantly block it. If I have a drug that blocks dopamine, I'm going to have high prolactin. If I have a drug that increases serotonin, I'm going to have high prolactin. If I have a drug that blocks serotonin, I'm going to have low prolactin. If I have a condition that increases TRH, because it is a prolactin releasing factor, just like serotonin, I'm going to have elevated prolactin.
so whenever you have, like a condition, let's say hypothyroidism, whenever you have something that triggered the TRH to be released or stimulated, you're gonna have elevated prolactin, so it
Can have elevated
works
prolactin.
together.
Yep. That's
Why do you think there's so many people with hypothyroidism today? There's a lot.
I know, autoimmune thyroiditis, and you also have Hashimoto's thyroiditis, which is an autoimmune condition that's out there. I have no idea. In our society today, we should not have as much because we have iodine in everything.
Everything.
Yeah.
And we eat iodine every day. In underdeveloped countries, they have a lot of hypothyroidism due to the fact that they don't have iodine. Like their salt is not iodized, they don't have iodine. Remember, you need iodine to synthesize T3 and T4, thyroid hormones.
Because
Okay.
could that be a reason why a lot of women cannot have kids? Because a lot of people that I know.
Well, if they have hypothyroidism,
Yeah.
that can actually increase their, decrease their ability to have
Yes,
kids.
it's about all of them have hypothyroidism.
Exactly. It would actually decrease their ability to have kids because their prolactin levels are gonna be high. Okay? So elevated prolactin levels inhibit the pulsatile gonadotropin releasing hormone, which decreases your your FSH and your LH. Okay? And thyroid releasing hormone is a prolactin releasing factor and promotes the release of prolactin. Serotonin is also a prolactin releasing factor, and dopamine is a prolactin antagonist, so it blocks prolactin. This picture says the exact same thing we just said. Okay, do you guys want a break?
Yes.
Please take a small break and then come back.